So the next question is, which of the following chromosomal abnormalities are associated with the brain tumors? The one is the neurofibromatosis type 1, neurofibromatosis type 2, Peutz-Jeghers syndrome, and HNPCC, that is also Lynch syndrome. So the question is directly from the Bailey. So there is a table in the Bailey which says the chromosomal abnormalities associated with the brain tumors. So the first one is the neurofibromatosis type 1. The gene defect is neurofibromin on the chromosome number 17. The tumor associated are astrocytomas and the neurofibromas. The second is the neurofibromatosis type 2. The gene defect is schwannomin or the Merlin gene on the chromosome number 22. The characteristic feature are acoustic neuromas which are bilateral, and then meningiomas. And then our fourth option is HNPCC, hereditary non-polyposis colorectal cancer, where we have multiple gene defects and the tumor associated is astrocytomas. There is no mention of the Peutz-Jeghers syndrome. So the neurofibromatosis type 1 is associated with the brain tumors like astrocytomas and neurofibromas. So this is correct option. Neurofibroma type 2 is associated with acoustic neuroma, which are bilateral, and meningioma. Then HNPCC or Lynch syndrome are associated with the astrocytoma. So second is also correct, third is also correct. So correct answer will be 1, 2, and 4. If we see for the option number Peutz-Jeghers syndrome, the Peutz-Jeghers syndrome is not associated with any brain tumor. If we go by the reference, we go to the Robbins. So we have a reference from the Robbins which tells about the Peutz-Jeghers syndrome. So in the Peutz-Jeghers syndrome, the Robbins write that the Peutz-Jeghers syndrome is associated with markedly increased risk of the several malignancies. Lifetime risk is approximately 40%, and regular surveillance is recommended beginning at birth for sex cord tumors of the testes. So it is associated with the sex cord tumors of testes. Then in the late childhood for the gastric and the small intestinal cancer. So it is with the gastric cancer or small intestinal cancer. Then in the second and the third decade for the colon cancer, for pancreatic cancer, for the breast cancer, lung cancer, ovarian cancer, and uterine cancer. So in the later decades, it is with the colon carcinoma, pancreatic carcinoma, pancreatic cancers, breast cancers, lung cancer, ovarian cancer, and then uterine cancer, but it is not associated with the brain tumor. So Peutz-Jeghers syndrome will be the incorrect option. So Peutz-Jeghers syndrome is not associated with the malignancy in the brain. So the correct answer will be B. So there are other two syndromes also mentioned in the Bailey table from where the question has been asked. So we will also be reading these two. One is the Cowden's disease and second is the Leigh-Fraumeni syndrome. So Cowden's disease, the gene defect is in the P10, which is on the chromosome number 10. The tumor associated is astrocytomas. And the second one is the Leigh-Fraumeni syndrome, which is on the chromosome number 53, that is on the chromosome number 17, and the tumor associated is astrocytomas. So they can also be asked in the next exam. So it is Cowden's disease and Leigh-Fraumeni syndrome are also the chromosomal abnormalities which are associated with the brain tumors. So the correct answer will be the B. So it's the correct answer.